Hi there, my name is Jaime Miranda. I am based in Peru, and I work at the Crónica Center of Excellence in Chronic Diseases at the Universidad Peruana Cayetano Heredia. First of all, thank you for having me in this conversation. It's very nice to contribute with our, or at least some of our experience conducting research in Peru, and also seeing a lot of people transiting with us and through Peru for a variety of reasons, some of them training related. Before I start sharing with you my views, I think it's important to give you my personal disclaimer. As a physician, and after graduating in medicine, I did work in rural areas, and I saw a lot of development work happening in particular in the Andean communities in Peru, very rural areas. And then I worked organizing an elective course in international/public health/global health for medical students from the UK traveling abroad. Now, back in Peru, I do sit and I do work in a university with a lot of students. So it is this mixture of experiences that will, indeed has shaped my views. My contribution to this conversation would be around how we frame the topic or the general issue of global health, and in particular, global health training. My biggest worry is that so far what we are developing, what we are exposing, what we are teaching, what we are seeing is a one-way route, whereby, by large, what is called global health is a view from the north to activities, individuals, people in the south. A number of years ago, we published a little piece calling it Global Health Training, One-Way Street. Is it a one-way street? Which help us, now being back in Peru, help us reflect on how is it that we see ourselves in this interaction, and whether this interaction will mark the challenges for future training. Therefore, I would like to bring this element of criticism for this fishbowl, for this interaction, in that if we are going to be very frank and very honest with ourselves, global health training, it has to be, it's a non-negotiable, it has to be a two-way interaction. Otherwise, we keep under the same paradigm of some people looking at the others, okay? And that's something that has to be broken with these new paradigms. I don't have a perfect solution for this to contribute, but I do see that, leaving aside the programs, the degrees, the titles, the institutions, the courses, and all these rich elements that make a training program a good program, there is one that has to be priority, and that is people. If we want to call this a true global health training, it has to be a meaningful, respectful, horizontal interaction. I would like to leave you with 3 questions that may contribute to your interactions. And the first one is around duration of the program. How long has a global health training program has to be a meaningful one? Is it a 1 week? Is it a 2 week? Is it a 6 months? Is it a year? 2 years? I don't know. The second one goes around the direction of the interaction. Is it a north-south? Is it a south-south? And why not a south-north? Why the observed ones have to be based in the south? Why, with all these massive societal changes and transitions, why people from the south cannot go and see the other in the north? And number 3 is around the expectations. What's in it for you? What's in it for me? What's in it for us, for the program, for the experience? Let's be clear about those expectations too. Thank you very much. I wish you have a very entertaining and exciting discussion. Bye-bye.